All right. Hello, everybody. Dr. Rafich here, Vet Triage. September 20th, 6:55 p.m. Pacific time. Let's do it. A little late today, but that's all right. Red eyes in dogs. There are certain scenarios where an ocular problem, an ophthalmic problem, is an emergency. There are other times where it's not. Sometimes it's an emergency because you risk losing the eye or losing vision. And just in case people notice a glitch on the playback, the live stream just restarted. So anyway, sometimes the emergency with the eyes is you may lose the eye, you may lose vision, or it's very, very painful. And otherwise, if it's not an emergency, then it's more of what can we do to take care of the pet until your vet can see you for an appointment, because it's not an emergency, so it's not time sensitive. So red eyes is a very common concern in the medical field because, excuse me, a red eye can imply something like very serious or not. It just depends. So seeing a red eye in a dog, if you start Googling it, you're probably going to find all this horrific stuff, which, may be true, but also it may not apply to your dog in particular. So let's talk about red eye. So number one, and this is in no particular order, glaucoma. Glaucoma is defined as an increase in intraocular pressure, the IOP. And if the IOP goes up enough, you risk causing internal damage to the eye. And if you cause enough internal damage to the eye, you could go blind. And so if you notice that your dog's eye is red, the question is it glaucoma? Now, obviously, your vet will perform ocular testing, including using a tonopen, so tonometry, to measure the pressure in the eye. They use a little bit of local anesthesia for the eye, some lidocaine derivative, and it's called Marcaine is the chemical compound, and they numb the eye and then take literally a pen and tap the very tip of the pen on the eye. It gives them a number, and they do a few measurements to make sure it's accurate, and then there's a normal range. But at home, you may not be able to tell that. And so signs that your dog may have glaucoma include having a red eye, include having an eye that's a bit on the bulgier side. And the dog might be showing signs of discomfort, restlessness, whimpering, maybe pawing at the eyes. But otherwise, you won't be able to tell without doing testing if it's glaucoma or not. There are certain breeds that are prone to glaucoma. There are also congenital forms of glaucoma where they're born with it. There's acquired forms that develop it over time. That's glaucoma. Usually glaucoma is considered an emergency. Now, in a veterinary setting, if you know how high the IOP is, that'll determine how urgent it is. But at home, if glaucoma is suspected, then it's typically an emergency. And then your vet will focus on trying to decrease the IOP. Second cause of red eye, hyphema. Hyphema means blood in the eye, typically in the anterior chamber. So you'll see like blood in the eye. Sometimes it's just a portion of the eye. Sometimes the full eye is blood, but it'll be red. Hyphema is caused by a variety of causes, because that itself is not a diagnosis, that's a symptom. Hyphema can be from ocular cancer, it could be from lens luxation or rupture. It could be due to infection in the body, like heartworm disease, any sort of bleeding disorder, trauma can do it. The point is there's lots of issues, there's lots of potential causes, most, if not all of which are serious. And hyphema typically is considered, again, a medical emergency. With a lot of those cases end up having probably an amputation, a nucleation rather, of the eye, loss of the eye, removal of the eye. So that's hyphema. Hyphema is typically an emergency, not always, but it can be. That's a difficult one to assess from home. But your vet will do all the necessary testing and try and figure it out. But it could be hard to figure out, because if your pet has a bleeding disorder, that's going to require testing that goes beyond the eye. You're going to have to look in the actual body to see, with x-rays, sonogram, specific blood tests to figure it out. And if it is cancer, the question is, well, did it spread to other parts of the body? So you're going to perform diagnostics to see if there's any metastatic disease or cancer spread. That's hyphema. Third would be any disease that causes scleral injection. So the sclera is the white part of the eye. So our front part of the eye is clear, and then if you notice the back of the eye is more on the white side, and that's the sclera, sclera. Scleral injection means there's redness of the sclera. Usually you'll see like these blood vessels coming through that aren't normally there. You may look at your dog's eyes right now and say, well, he's always got blood vessels going in there. And that's because a lot of these breeds that we like to have that have the bulgy eyes, like pugs and chihuahuas and Pomeranians, they have exposure keratitis, which means that their eyeball is constantly exposed to the environment because their eye is so bulgy and their skull is so dome shaped that when they close their eyelids, it doesn't cover the entire eye, and so portions of the eye gets dry, and they end up with the vessels that protrude in the eye. But in general, scleritis, scleritis, inflammation of the sclera, scleral injections, scleral erythema, whatever you want to call it, can be due to a variety of causes, whether it be infection of the eye like conjunctivitis, whether it be glaucoma, whether it be dry eye. But regardless, that will look like a red eye. A lot of times it's not an emergency for that. And especially if your vet is considering something like corneal degeneration or exposure keratitis or KCS, which is keratoconjunctivitis sicca, which is also dry eye. It's not technically speaking a medical emergency for the eye. You can wait and be seen by the vet. It's uncomfortable for the dog, but it's not like intractable pain where they have to go in and be on narcotics and stuff. So scleral erythema can be caused by a variety of things, and that can cause red eye as well. Yeah, and I think we'll stop there. It's important also to know that the eye should be considered not just part of the body, because obviously it's an extension of the body, but actually it's also its own organ. It's immunologically protected from the rest of the body. And so it's very rare to see infection go from somewhere else in the body to the eye. And it's also not common for cancer to spread from the body to the eye. Typically those infections originate in the eye because the body protects the eye. If there's a barrier, if there's a loss of the barrier that protects the eye from the rest of the body, then yes, you can have disease that goes into the eye from the body. But the eye is pretty unique in that way. It's its own encapsulated thing and its own little organism, let's say. But well, the reason why I said that is because you could have multiple diseases of the eye happening at the same time because it's all confined there, right? So you can have glaucoma, which then causes progressive retinal detachment, which also can cause lens luxation. If the lens gets dissolved by the eye, then you'll end up with immune-mediated uveitis, which is inflammation of the uvea, which is the internal organ of the eye. And so all these things can connect because it's all combined. And so eye disease can be very complicated. And for those of you who have experienced eye problems with your dogs and seen specialists and things like that, you know how complicated it can be. Especially because animals are not very cooperative, right? They don't notice sit there and open their eyes and look left, look right, look up, look down. They can't read. They can't look at images. So it's very difficult to assess the healthy eye for animals. Okay, well, I think that's it for today. Hope that helps. We'll be on again tomorrow, Saturday, September 21st. In the meantime, thanks for those who watch the playback, and we'll see you in the next one. Bye. Bye-bye. Bye.